What causes the formation of stones in the kidneys and bladders of neutered male cats? And what kind of nutrition is suggested for such cases?
Well, the formation of stones in cats is actually a very complex issue. There can be very many factors that are not diet related, such as stress or infection, age, thirst, and probably more is known though about the influence of the diet. In general, stones are produced when the concentration of certain minerals such as calcium and phosphorus and also magnesium are very high, and also the environment is conducive. There are many types of stones or crystals, but the two most common types are struvite and oxalate. Now the first actually requires an alkaline urine to form, whereas the second requires an acidic environment. And different nutrients in the diet can cause the urine to become acidic or alkaline, and so can have an influence on the formation. However, by far the biggest influence is the concentration of the minerals. For this reason, it's very, very important to balance these minerals and to ensure that the cats have access to plenty of clean, fresh water so that they don't become dehydrated and produce concentrated urine. Also, urinary stone problems are particularly prevalent in neutered male cats because their urethra is very narrow, much narrower than in females, and they have a tendency to put on weight, which can also be a contributory factor in stone formation. That's why we have to be particularly careful when feeding castrated male cats. The pH and mineral levels are very carefully balanced in all of Chartai's formula to minimise the risk of urinary stone formation, and particularly for neutered cats, Bonacebo Light and sterilised should be used.